gosh. All right, I'm Dani Williamson. This is Dr. Joe, and we have a guest in here tonight. Today. I'm so excited. This is Dr. Justin Deering. And I'm so excited because he is going to be, as you guys get logged on, people, hit your heart buttons, hit your like buttons, all those things. You can share this because you're definitely going to want to share this. This is how you manage stress with managing stress with acupuncture and herbal medicine. All right, with an ancient Chinese doctor over here. He's not so ancient, but he practices ancient Chinese medicine. And you're going to want to share this. So you can click share, start a watch party, and then start a watch party again, I think. So that's what we're talking about today. Happy Good Friday. Happy Easter. It's good to see you guys on here. I'm Dani Williamson. This is Dr. Joe.
Yes.
I never can say his last name, so I just call him Dr. Joe. So
everybody calls me by Dr. Joe, but Phiakhamta, when you look at it, it looks intimidating and you really can't pronounce, but when you hear it, it's easier to pronounce.
Phiakhamta,
yep.
Dr. Phiakhamta. Yeah, they're laughing about that. So, and then Dr. Justin Deering. But the reason Dr. Deering's up here is, of course, he's curious and always wants to learn things like I do. He is going to be our guest on Sunday night service next Sunday night. And we are talking, next Sunday night, not Easter. We're not going to be open Easter, or not going to be doing that Easter, but next Sunday night, we're going to be talking about
the gut-brain axis.
Yes, I'm glad you remembered.
And the stress response, which is going to overlap with Dr. Joe's conversation today.
Right, so it'll be like a part 2 continued, and you won't want to miss this because you know I love this guy as a functional neurological chiropractor over there. He's helped me tremendously with vertigo and all, so I'm excited. He's going to sit here and listen today, though, as a student.
Yes.
All right. All right, so we're going to get started. As you guys get on here, just say hello, all those things. If you have any questions for Dr. Joe, I've actually tagged him up here, True Acupuncture and Wellnes, unless you have something else you want me to tag.
No, that's good. Yeah.
All right, and then so you can ask questions and he can answer anything you want. So, all right, we're going to get started here. He's a doctor of Oriental Acupuncture and Oriental Medicine. Been in town 3 years from Austin, Texas, right?
Yes, ma'am.
And we're glad to have you. Yes,
I'm
ma'am.
glad to be
Stop
here.
that.
I'm sorry.
P.O.P. I'm the oldest one, probably.
Get into that Tennessee, ma'am.
Yeah.
It's all right. It's all right.
It's formal here.
So he's going to start it off here, and we're just going to be talking about managing stress. You going to bow out?
Well, sure.
We love to have you here.
Okay.
That's okay.
Absolutely.
All right, so we're all going to see. I get to be the best part of the sandwich right here in the middle. This is perfect. All right.
Dani, first of all, thank you for having me here. It's an honor to sit next to great healers here. I'm actually very intimidated right now sitting next to Dani and Dr. Deering.
Are you crazy?
I'm very intimidated.
What is wrong with you? This is your specialty. You know this. You could say anything, and I would know. Now, he might know something
I'm here to
different,
learn.
but I would not know if you were right or wrong. So always know that every time I stand up somewhere and I teach or I speak, I always have to think, I know more than they do. I know more than they do. You know, you forget that. Right? So you don't, good Lord, we're friendly
I
people.
am new to the healing field, so, but I have so much to learn from the both of you, but
you also have so much to share. Always remember that.
I will try.
Okay. All right.
So basically, this is more like a conversation piece rather than just like a presentation. I initially came thinking of coming here and talk about stress with statistics, but I'm just going to leave that part out. And just go more into the everyday stress, like how we all feel. And a lot of it is triggered by job, family, relationship, things like that. Yeah. And, stress can be good. Short term, it helps our body to respond to dangers. And for work, we meet deadlines. And long term, not so good.
Right.
And we all know, that it can affect us physically, increase high blood pressure, affects us digestion, and importantly, mental health.
Exactly.
Yeah. So some of the physical signs, chronic pains, headaches, frequent sickness, again, digestive issues, some low energy.
I thought you said freaking sickness. Is what I thought you said. I'm sorry, I just can't help it. I just can't. Which is true, right? Right? Freaking sickness. Stress will cause you freaking sickness. Just get up, learn it, people. That's right. I'm sorry. Keep going, sorry.
Yeah.
No wonder you're
I
nervous. I'm
love,
terrible.
no, I love your energy. It like
Okay.
just feeds me.
Okay,
Because I need more of that.
Well, I've got a
I'm
lot
too
of it.
quiet and, yeah.
I wasn't voted most talkative
That's
for
good
nothing.
stress.
That's
Yeah,
right.
that is stress. It's very good stress.
Okay,
Some of the emotional signs that we should look at is like just anxiety, high anxiety, a lot of worrying, irritable, frustration, easily angry.
Yeah.
Yeah, feeling
Yeah.
easily overwhelmed.
Yes.
Definitely. So what causes stress? Again, job, family, relationship, money, health, and death.
you bet.
Yeah.
Yes,
And also internally, it's caused by negative thoughts.
Yep.
Yeah, just negative attitude. There's actually a study, which I didn't know, optimism versus pessimism,
mm-hmm.
that if you're constantly thinking negative,
Mm-hmm.
you're likely to between 20 to 40% more likely to be more sick.
Yes, you are. Cardiovascular disease, heart attack, stroke. That's right. I actually shared that study 2 weeks ago. I can't remember when we did. Dr. Motley and I on Sunday night service did the power of positive thinking.
Mhm.
After we did the stress one, well, stress will kill you, and then we did the power of positive thinking. But that was part of that talk, and it is right. Your attitude and how you think about things can destroy your health or boost your health up.
So how do we know how much stress is too much? I mean, that varies from person to person,
Right.
and a lot of people strive off of stress. I don't know who that is.
I
but-
do.
Okay.
I do. It's one of the things that Teresa knows. Yeah, the more stress I have, I thrive. I get way more things done when I'm under the deadline and stress.
I need to follow you.
I'm better. I'm better with it. Now, I don't know. I could fall over. Who knows? But so far at 53, I've done okay.
Okay.
Mhm.
Yeah, and some will roll with it, and others just break down.
They sure do. They
Yeah.
shut down.
They
They
shut
shut
down,
down.
literally.
And those are the ones I get in this office. Mhm.
Now, from stress from a traditional Chinese medicine perspective, stress pretty much stagnates the flow of energy to qi. And when I say qi, a lot of people thinking energy, woo-woo, but really it's an ancient term and it has over 300 meanings, depending on how you use it. Qi is basically bioenergy and biochemical energy. So bioenergy is the energy in your body, and that is the human electricity called ions, and they're the sodium, potassium, magnesium, calcium, and those things like that.
Mhm.
And biochemical are the nutrients from food that you eat, and that gets when that's consumed, break down, it gets distributed throughout your whole body. So that's qi. So when we say qi, we don't mean like magic
Right.
power like Doctor Strange.
Exactly.
Right.
So yeah, and just keep in mind it's an old terminology, and when we say qi, that's what we mean. So, and the liver system, the ancient physician have this saying: "This harmony of the liver is the cause of 10,000 ills."
I believe that.
Yeah.
We were just talking about that at breakfast this morning.
1 hour ago.
Yes, 1 hour ago, we were just talking about that, the liver.
Yeah.
Tell us about it.
Well, the liver is responsible for the smooth flow of emotions, as well as qi and blood. So it's the organ that's most affected by high stress or emotions. It regulates, of course, bile secretion, stores blood, connected with the tendons, nails, and eyes. And usually that when the liver system is stagnated, it manifests as irritable, anger, resentment, frustration, bitterness, and angry.
That's right.
So the liver, it's a really important organ. When that is stagnated, like everything else along with it starts, it's like a domino effect. Because everything in Chinese medicine perspective, everything in your body is connected. So it's not compartmentalized, it's not individualized. So when we treat a certain system, we treat the system next to it and follow.
Okay.
Stagnation of the liver energy can lead to mass, lump, fibroids, tensions, pain, headaches, breast distension, menstrual pain, dizziness, red eyes, dry eyes, and tendinitis. In female, chronic stress, what I've seen most is a lot of breast lumps, breast distensions,
Wow.
lumps in the throat. And prolonged can lead to heart disease, as you mentioned earlier, stroke, high blood pressure, autoimmune conditions, fibromyalgia, chronic fatigue, depression, insomnia.
Right.
Yeah.
Right. That's the first thing we do in this office when they come in is work on their liver and do a liver detox, and a gentle liver detox.
Yeah.
And
Yeah.
that's right.
So the common patterns in Chinese medicine that I see, the 5 common patterns are stagnant liver qi, stagnation of liver qi turning into heat, and we'll talk more about that. Phlegm is a huge thing, but that's rare, and rebellious liver qi, meaning the energy is actually rising, so it's kind of like acid reflux.
Oh, wow.
Yeah.
Instead of just sending, right?
Instead of descending,
That's,
exactly.
yes, we want it all to
Yeah.
ascend to the feet. Right?
And liver yang rising, meaning, so the theory of yin and yang, our body has the yin energy and yang energy.
I'm sitting between yin and yang. What's between yin and yang? Yang.
Personality and life is
Energy, harmony,
Yeah.
energy. Okay,
So,
okay.
yeah, exactly. You're definitely sitting between yin and yang.
Okay, there we go.
We're both, you're definitely yang.
I am.
Yeah,
I did-
yes, outward and sunshine. And,
yeah,
and heat.
exactly, exactly.
Yes.
I did my Chinese element, whatever. I'm fire.
You're definitely fire.
I'm fire. No, I took the test and I am fire and wood.
Yeah.
I don't know what that means, but I'm fire and wood.
Wood is-
Danger.
Wood is liver.
Liver?
Yes.
Correct. I'm sorry.
Wood is
I'm
liver.
fire and wood.
Liver.
Okay. All right. Okay. Sorry. Keep
That's
going.
okay.
Keep going.
So clinical manifestation of stagnation of liver qi, epigastric distension, slight feeling of oppression in the chest,
Yep.
irritability, frustration, depression, moodiness, menstrual cramp, irregular periods,
Mhm.
and again, feeling a lump in the throat.
Yeah.
So how we treat that is soothe the liver, clear stagnation, and calm the mind. When we work with anything with emotion, we always have to calm the mind and spirit. And the favorite herbal formula for that for me is Chinese medicine. In Chinese, it's called Xiaoyasan. And in English translation, free and easy wonder powder.
Free and easy wanderer.
Yeah.
Powder.
Mm-hmm.
I don't even know what that is.
It's great.
You know, I don't know.
And the great
Sounds like a country music
the
song.
great thing about
Free
that,
and easy.
from my perspective to see it is that the nerve that goes to the liver, one of the
Mhm.
major nerves, is the vagus nerve.
Yes.
And it's termed that because it's the wandering nerve, you know. So the connection there is interesting, you know, from a Latin perspective.
So and I'll get to the structure of the herbal formula at the end, but that's in school. That is the most herbal formula that's flying off the shelf because of a lot of stress.
Wow.
It applies to everybody.
Yeah,
Huh.
applies to everybody, especially students.
Oh, yes.
Mhm.
Yes.
Yeah. And the second is stagnation of liver qi turning to heat. So with heat, it's obvious. You'll feel a lot of heat. Red face, thirsty, propensity to outbursts, heavy periods, restlessness, hot flashes, insomnia, and night sweats. So that's
That's what I got.
That's chronic. Yeah.
That's right. Minus the heavy periods. Outbursty, red face, red hair, restless, hot flashes, all the things. Okay.
And great herbal formula for that is just a modification of the first herbal formula, Xiaoyasan. We add With that one, we just add a couple of herbs to help clear heat, and that's called Jiawei Xiaoyusan, and that's augmented rambling powder.
I couldn't say that.
I'm sorry?
I said I couldn't repeat that.
No.
Yeah.
Yes, I've heard of it.
Yeah.
That's great.
So, third pattern is liver qi stagnation with phlegm. So chronic stress, like long-term, it had to be a lot, long-term, I'm sorry, it's mental depression. Lump sensation in the throat again, difficulty swallowing, excess sighing, coughing with phlegm, swelling and pain. So phlegm, it's definitely difficult from Western perspective to grasp, because when I started out, I couldn't understand like phlegm, like,
Yeah.
how can I phlegm? Like, no, there's an invisible phlegm, and then there's the material phlegm. So the material phlegm is what you can cough out. The invisible phlegm is more like the clear, sticky fluid, and the reason why that causes a lot of mental depression is because phlegm will stick to everything and it will block your orifice.
This is something I deal with really, really badly.
Really?
Excessive. I'm coughing a lot, and it really affects me for a long period of time after I have a cold.
Mhm.
And I'm coughing it up right now all the time. I'm sure he heard me all night hacking. And my cold's been gone, long gone, but I have a lot of that.
That would be a different type of phlegm.
Really?
Yes. That would be more like an external pathogen phlegm,
Okay.
creating that. May have some residual pathogens,
Okay.
and so your body is still trying to clear that out.
Mhm.
Um,
But I mean, it's even when I don't have a cough that I have
Mhm.
that kind of, it just
Okay.
gets worse. When I do have a cold, it makes me notice it more. You know what I'm saying?
Okay, then you would be a good candidate for this herbal formula.
Well, I also have that high enzymes for my liver. I was told I have a possibility of going into fatty liver. So is that anything that's related to this as well?
Possibly, yeah. So, Banxia Huopo Tang, Vanilla and Magnolia bark decoction, that is a good formula for that, for what you have.
Because I do have a thick feeling
Yeah.
all the time.
Yeah.
Thick. Like
Yeah.
everything's swollen and thick and hard to
Yeah.
swallow.
That herb, and when I learned herbs, I learned it in pinyin, like in Chinese name. So we didn't really learn the Latin or the English name. But huopo is actually a good herb that will help break up that phlegm and clear it.
Can she get that with you?
Absolutely.
Okay.
Yeah, that's not stuff you have, but you have.
Yeah, I don't have it.
Yeah.
I have no hope here.
Okay.
I mean, yeah.
Sorry, I don't know. I'm sorry. I am very professional, honestly, really, with my patients, but
Well, that's
no
good.
hope.
'Cause I'm really not.
It's a good
I'm
bumper
not
sticker.
professional with my patients.
Oh, Lord.
It's what you see me outside is what you
Okay.
see in the clinic. But,
Oh, gosh. Okay.
yeah, but that herbal formula is really good for you. It'll help activate the qi, resolve phlegm, dissipate the nodules, and relieving all the stagnations that you have. Rebellious liver qi.
Oh, there we go.
So hiccup, belching, sighing, nausea, turning feeling in your stomach. So that's the liver, rebellious liver qi.
Would you also consider heartburn? Some may call it.
That would be the heartburn. That would be more rebellious qi of the stomach.
Oh.
Qi, rebellion. Yeah. So that's a different formula. That's Iguanchen, which is strain the liver powder, and that helps to calm the liver, clear liver heat, nourish liver blood, and strengthen the spleen.
Okay. Are these teas or tinctures or what?
That's a great question. So there's the most effective, and my favorite is the raw form where you get it and you cook it at home.
Yeah.
And you have
That's
that
what he-
herbal aroma
Yeah, he likes
throughout the
that too.
house.
Sure. And it adds to it, right?
Yeah.
The smell, the taste, the touch, all
Us,
those
you
aspects.
know, and you drink it hot like tea. I'll just sip on that all day long.
Right.
And
Does it
it's
taste like broth or does it taste like good tea?
it's just more tea, more earthy taste.
That means unique taste. Yeah, that's like, a very tiny house,
But,
it's a cottage, like you can't turn around in it. Yeah, this is
If you get the herbal formula, Xiaoyosan, that easy and free water, that tastes really good. Yeah,
What makes that taste good?
I'm sorry.
What makes that taste good?
It's just all the herbs together. It's just the aroma. It has an aromatic formula, sweet.
Sure.
What does it
smell.
taste like?
I can't tell you.
we
Because
should
it's hard to
have,
describe.
we should have had some of that here.
Yeah.
Yeah, I
I
didn't think about
actually
that. I
thought
didn't
about
think
it.
about that. You should have said, we've got teapots here. We could have done the whole thing.
Last question, is there licorice in there?
Yes.
Yes.
Licorice is
Licorice is
in probably 99% of the herbal formula because it helps to harmonize all the herbs
many
and
reasons.
reduce toxicity. There isn't herbs.
So that's a pretty strong taste, so does that kind of stand out?
The licorice?
Yeah.
No, the most that we'll use in the herbal formula, depending on how big, but if we prescribe for a week, it's only 3 grams of licorice.
Okay,
Yeah, so very, very small dosage.
okay.
And the last one, liver yang rising. Ever drive down the road and during a traffic jam and people just screaming at the wheel?
Uh-huh.
That's liver yang rising.
Liver young
Yeah.
rising, roadway rage, yeah.
Road
Okay.
rage, that's the.
There's too much of that here.
Yeah.
In Nashville.
Oh, yeah.
I always,
Had a little episode of that
Had one,
over by
yeah.
Whole Foods the other day. I acted ugly.
What are some other scenarios that you might experience?
the headaches, like really bad headaches, eyes, lateral side of the head, dizziness, ringing in the ears, blurry vision, dry mouth, dry throat, insomnia, irritability, feeling of just being worked up, and stiff neck and shoulders.
Well, that's
'Cause you're
most of
the
my
one.
patients. Wow.
Most of
Isn't that
my
most of
patients as
yours
well.
as well?
I would say a lot of human beings.
Yeah.
Stiff neck.
Yeah,
Yeah.
for sure.
Would vertigo have anything, where would vertigo go?
Vertigo would be more with phlegm,
Oh,
because that's blocking your orifice.
It's coming from kidney? Chinese medicine?
Yeah,
Yes.
yeah, kidney.
okay. All right.
And really good formula, and this is tianma-quintonine, gastrodea and urea decoction. It helps to extinguish liver wind, clear heat, invigorate blood, and tonify liver and kidney. And the wind, so that, again, this is an ancient term. So if you look outside during springtime, there's a lot of wind and a lot of trees shaking. So they, when it happens internally, we call it's called wind because it's a lot of tremors and things like that. And it's just crazy outbursts,
Oh,
Neurological
neurological
issues.
issues.
I see
Exactly.
a lot
So
of
that would be
this is
a
what he
wind.
deals with.
Yeah.
Oh, really?
I thought about
Yes.
wind many times a day. So
Mhm.
it's a great concept.
So it's actually another good formula for a Parkinson's patient as well.
Really?
It's true.
Okay.
And so, herb prescriptions, how we prescribe that is one, we determine our prescription based on the temperature of the herbs, the flavors, and the movement of it. And the structure of formula, this is, every time I tell this to my patient, they just look at me like, why can't I just take one? Can I just take curcumin or turmeric and be good? I'm like, no, it
Oh, I
just
hear the
doesn't
same
work.
thing.
It doesn't work like that. But Chinese herbal formula has been applied for thousands of years and refined. So the way it works is that you have a chief herb. That herb is the main herb that targets the disease or syndrome.
Okay.
And that could be from 1 to 2, 3 herbs. And then you have the deputy herb that assists the chief herbs. And that, again, it could be 2, 3 herbs.
Okay.
And then you have the assistant, which assists the deputy and the chief herbs.
Mhm.
And then you have the envoy herbs, which is more like a guide herb. So it carries all the herbs above and disperses it throughout the whole body or to the disease.
The chief, the deputy, the assistant, and the envoy?
Envoy is like a guide, carrying all the herbs.
Now, is that all in one concoction that we can make, so you don't have to
Mhm.
do a million different things?
Exactly.
You're doing it all in one thing, okay?
Well, and it's important to do a formula because one, if you just drink one herb at a time, it doesn't really do what it's supposed to do because in herbs has multiple agents in it.
Okay.
And so some of them might not be good for you. And so you need to add herbs in that will help neutralize that agent's effect or function.
Okay.
And then that's how it works. Like ephedra that years ago has been used for weight loss,
Mhm.
and then find out it shut down your kidneys or
Yeah.
and then the FDA banned it.
Mhm.
Well, it's actually really effective herb and safe for common cold.
If it's neutralized by
yeah,
the hormones, right?
Yeah.
Huh, I didn't
When you
know.
put that herb in a formula, it's really safe and it's good to for body aches to help you sweat to leave.
So they have a synergistic effect.
Exactly.
Okay.
That's what I was trying to think
There
of,
we
like, synergistic
go.
effect. I
Okay.
was like,
So it's just like taking vitamin C with your iron. Iron and vitamin C work synergistically together. They help each other work better. Iron works better if you have vitamin C, and C is better if you have some iron. So there. Okay.
Precisely.
So that's it. Okay.
Yeah, precisely.
Turmeric and pepper.
You bet. You bet.
D&K.
D and K,
There you go.
turmeric and pepper. We got it. Peanut butter and jelly. Same
That's
thing.
right.
That's right. Yeah. They work better together. Okay, I got it.
Yeah.
Okay.
So lastly, to self-treatment.
You bet.
For me, of course, for running a business, there's going to be a lot of high stress. And so my favorite is just leaving everything at home and just go walk around Radnor Lake.
Sure.
Because, I mean, that allows you to just bring yourself back
Yes.
internally, physically. And then that really helps to, you can confirm this, change the structure of your brain.
Sure.
Chemistry.
Sure. Balance of the mind and help the body to stimulate the brain and calm it down. Yeah.
Yeah.
We talked about that.
We
this
talked
morning.
about that at breakfast this morning too. The power of walking, and you're moving your arms and your legs, and your eyes are calibrating things, right?
Absolutely. To orient you to your environment.
Mhm.
And that's what we do.
The Japanese, what they do is they have forest bathing.
Yes.
Yeah.
Oh, explain what forest bathing is to these people, because I'm a big one on grounding and earthing. And so
Yeah.
talk about forest
So-
bathing.
They did a study, I forget when, but for anyone, if you go and just walk through the forest, without any distraction, it actually changes the chemical structure of your brain. It changes your brain.
Yes.
Yeah.
It's called Shirin Yoku. Is that right?
Yeah.
Yes.
Yes.
So that's something you can Google and find out.
Yeah.
Yeah. It's great.
Absolutely.
Yeah.
Support network. Huge.
Bet.
You need to have that.
You have to have community.
Families, friends, therapists,
You bet.
Danny, Dr. Deering.
Acupuncturist,
Absolutely.
right?
Yeah.
An attitude, just be positive.
Mhm.
Always. I know that's hard, but it really, really goes a long way. I mean, just smile. My favorite quote is smile, breathe, and go slowly.
Yeah.
Smile, breathe, and go slowly.
Mm-hmm.
Well, I can smile and I can breathe, but I don't understand that go slowly thing. I'm like a
That's
ping pong
that's a
ball.
good practice.
Okay. Yeah.
Sure.
Okay. Smile, breathe, and go. I need that on my mirror every day. Yeah, in my bathroom, in my kitchen, in my car.
And just to be aware of your emotions. I know with everybody's lifestyle today, it's fast paced, and we forget our mind bodies, and so just step back and just be aware of our emotions, and just calm yourself.
That's right.
And last but not least, meditation and breathing exercise.
Yes.
Yes. I'm huge with that. And so do you recommend things like Calm, the app, Headspace or Insight Timer or Calm, or do you use any of those with your patients? Because I do, and they work really well.
I do. When I have my patients on the table, wipe a little bit of lavender oil, essential oils on them, have them face down, turn on some relaxation sounds, and they'll nap for like an hour.
I see it too. Yeah,
Yeah.
it's great. Do you give them specific meditations or like a mental exercise of any sort?
Yeah. So the easiest thing, and what I always tell my patient is to just do a breathing exercise, regardless of what you're doing. Just focus on your breathing to your lower abdomen, hold it for a few seconds, and slowly let it out, and just repeat that process.
Right.
And I have my patients do that when they're on the table, because especially the one that come in with just mind just
Sure.
jumping here and there. Just stay on your breathing.
Sure.
And if your mind wanders, come back to that breathing.
That's
And
right.
that always helps.
You bet it does.
It's amazing.
Well, we don't breathe. You know, we only use about 15% of our lung capacity as humans. That is unbelievable. There's 85% more lung capacity to use. We don't feel these big, we don't breathe. Just taking deep breaths when you get stressed, just 3 deep breaths will really reground you. It's as simple as that.
It is.
15 seconds, 20 seconds. It's really pretty fascinating. But we don't breathe. Our shoulders are here.
Yeah.
We're very shallow breathers, you know, and then, I mean, just physically lowering your shoulders and taking a deep breath calms you down immediately.
That's right. And also it's important breathing the Krebs cycle.
Oh, hush. I don't want to talk about the Krebs cycle. I
let's
hate
go.
the Krebs cycle.
Let's go.
You two can talk about it. I'll lean back on this one.
Well, it's very similar to the Chinese medicine process. And when I was looking at it, I'm like, oh, that looks familiar, but it actually, your breathing and is really important to really transform the food and mixing it
Thank you.
and dispersing it to your body. And so that's
Sure.
really, really important.
So you point out the Krebs cycle being the way the body produces energy. Every cell does it.
Yeah.
And back to the liver and helping the liver to maintain the flow of that energy or
Yeah.
that chi. And it's a big wheel. It's a harmony.
It's a very important wheel.
Yes.
You bet. And also eating healthy.
Yes.
You have to eat well. Okay, so here's what I tell my patients. You have to eat well, sleep well, move well, poop well, decrease stress, and you have to have community. Those are my 6 steps to healing. That's the class that we teach here. And that's basically what you've said here. Garbage in equals garbage out.
Exactly.
You can do all this you want, but if you are eating a packaged, processed, bagged, canned, tubed, fake food diet, there's not enough acupuncture in the world to help you get through that. Am I right?
You're absolutely
Okay.
right. And which I forgot to bring up is that the other pattern is liver chi overactive while explaining the stomach. And so had a patient yesterday come in with high stress, and she's like, I'm like, what are you here for? Constipation. I'm like, oh, any problems with digestion issue, anything? She's like, no, all normal. Any trauma in your life? No. Are you stressed? Yes. What's your stress level from 1 to 10? 12.
Yeah.
Like what?
Yep. I see it every day.
Yeah, it affects really your whole body. So you just need to calm down.
You need to calm down.
Yeah.
And you can drink all this tea, you can do your concoctions and all that, but if you don't manage those, I use 6 things, but if you don't manage those 6 things, nothing else works. And I tell patients this, you can't take enough supplements or drink enough tea to fix a bad diet or a
Right.
stressful life or not sleeping. Your body heals when you sleep,
Yeah.
right?
Right.
And if your bedroom is full of electromagnetic fields and all the things, and it's dirty and nasty and piled up with stuff everywhere, and you can't relax in there, and your body heals, especially between 10 and 2, right? Is that right? I can't remember exactly, but that's when things start to detox. And if your liver's not working right, your liver only weighs about 4 pounds, right? And it metabolizes pretty much everything in your body. And when it starts to gunk up, all these things start to,
Exactly.
it's a domino effect,
Exactly.
right?
Exactly.
But we're raising kids right now who are so stressed and so out of sorts, and they They don't get outside. They don't take their shoes off and get their feet on the earth. You know, I'm a big proponent of putting your feet on the earth as long as the grass is not loaded with, you know, tons of Roundup and all of that. But getting your feet on the earth and feeling those negative ions and taking a deep breath and just breathing, for crying out loud. And the kids are so worked up. And so you can't be a normal child anymore and go anywhere in life. It's just so sad.
Learn these things. It's very important. Pay attention.
It's, yeah, I mean, it's something that it's there every day, but we choose to ignore it.
And it's killing us.
Yeah.
We have more chronic disease in the United States than we've ever had in our life. And it's just going up, going up, going up. You know, we're living longer. I don't know if that's good or bad because we're sick as dogs. You know, we're dementia setting in and Alzheimer's. I'd rather die today if I knew I was going to get Alzheimer's disease. I mean, today, just go on because it's been a good life. I mean, and we are just progressively getting sicker and sicker, and we're living longer, and we can't build enough memory units out there and Alzheimer's homes because, you know, and there's no cure for that.
Right.
Right?
There's prevention.
There's prevention.
Exactly.
Alzheimer's is a disease of prevention for sure.
Definitely.
So what is your favorite thing? What do you love to do? What gets you excited when you see this patient coming in and they've got something up with them? Because I know what I love. I love autoimmune. I hate autoimmune disease, but I love treating and working with these women and men. What do you love? Do you have something you just love?
What I
Because
love,
we all do, right?
what I love to treat is pain,
Pain.
all kinds of pain.
Woo-wee.
Body pain. And that could be our next talk.
Okay.
But recently, I'm just treating a lot of stress, anxiety, and that I love treating that as well. Working on that. Cancer patient, side effect due to chemotherapy, and that's like more like personal issues. My mom was diagnosed with, she had breast cancer, cancer-free. And so and a really good friend of mine died from cancer at 46. And so cancer is I'm making that as a personal mission. To fight.
What you could do with someplace like Tennessee Oncology
Mhm.
or the big oncology units, you know, and bringing in Chinese medicine while they're getting their chemo, if they're sitting there in a chemo chair, would that not be something?
That would
Need
be
to get you in these
That would be
places.
ideal, but I don't know.
You have
if
to go
that's
through all the red
possible.
tape
Yeah,
and they would,
there's
yeah.
loads of
That
red
would
tape,
be
but the benefits are just tremendous, and there's studies on it, and
Yeah.
it should be part of the
Huge,
system.
yeah.
So,
We have a broken healthcare system. We have a broken system. We don't practice healthcare, we practice sick care. And you have people like you. I'm so thrilled that we have people like you. We have people like Dr. Deering out there, and we have people like me, and we have people like Teresa Greco sitting over here doing colon hydrotherapy and, you know, all the different things that we have to do to take care of ourselves.
Right.
But the bottom line is, if you decrease the stress in your life, and I tell patients this every day, you have to automate, eliminate, and delegate, right?
Right.
You have to eliminate everything you can in your life that
Right.
you don't have to do. I mean, there's one thing in this office that only I can do. Nobody else in this office can do it. I am the only person who can do it, and that is see patients and make the money.
Right.
That's a big one. Everything else I can keep my nose out of, and I should keep my nose out of it. I'm not so good about that because it's my name on the front door. But that's the one thing that I can do. I can eliminate all the other fluff,
Right.
and then I can delegate the other things that can be done. But automating, if going to the grocery store freaks you out and you hate going to the grocery store with 3 little kids and, oh my gosh, I couldn't stand it when my kids were little. It was awful. Then you know what we have now that we didn't have then? We have Ship Shop, or we have Kroger Deliver. We have all the things who can deliver it if that makes your life easier. Then automate everything you can. Eliminate the people and the things in your life that are causing you stress. There is nothing wrong with getting rid of people in your life.
Absolutely.
Nothing wrong. People will drag you down quicker than they will ever lift you up. And those soul suckers, like jobs, people can be eliminated,
Absolutely.
right?
Absolutely.
You teach people how to treat you. I'm a firm believer in that. And if you don't set boundaries and take care of yourself, no one else will.
Right. Yeah, absolutely.
And then you can delegate everything else. Eliminate, delegate, automate. Those have been my 3 words of 2019 I've been working on, trying to do better.
Yeah.
I'm better.
Yes, you have to be present for that.
Present,
You do.
definitely present.
You have to be able to understand where the stressors are. A lot of people don't quite understand it, maybe because they don't spend enough time relaxing. So reduce the stress. Yeah.
Yeah. And if you can't fix the stressor in your job or your marriage or whatever, then possibly you have to change your mindset. You have to change your mindset. Not everyone can get a divorce. Or, I mean, not that I'm promoting that, but I got out of it. I chose to get out of it. I made a choice to get out of it. But some people, that's not an option, or they can't change their job. So then you may have to change your mindset about the way you think about it.
Right.
And that's a big deal because you might not be able to get rid of that bully in the office, right? And if you can't leave the office, then you may have to get rid of, and I talked to a woman about this yesterday. She works at Williamson Medical Center, and there's a big bully in her department, and she can't leave her job, and her husband wants her to leave her job, and she don't want. I said, well, then, you're going to have to change the way you think about the whole thing. If you can't leave, then you change your mindset because you're not going to change the bully,
Right.
right? But her cortisol levels are just through the roof every time she walks into the office. That's that bear that we were talking about in those adverse childhood experiences, where that bear, ideally your cortisol levels rise and then they drop and they fall off, but they don't when you're in a situation like that. The minute she walks through work at Williamson Medical, her cortisol levels go up because that bear's in there. The bully bear.
Yeah.
Fight or flight.
It's right,
Fight.
right. And then it's a vicious cycle, right? So you love pain, you love cancer treatment, working on call it pain from the chemotherapy and things like that. Good. Do you have more women? Oh, stop it, I'm not. Do you have more women than men in your office, or?
I do have more women in my office than men because it's the word needle that scares men away. Surprisingly, yes.
Needles, men don't like.
Yes.
I call them pins oftentimes. If
Yeah,
they're
pins.
freaked out by the needle word.
Yeah, I starting to change that too.
Yeah.
When I was interning, I had a patient come in, and this is when I was volunteering at a community center. A guy walks in, bald head, ear bust all over his face, tattoo, huge guy. He's the type of guy that you would see on the street and run to the other side just to avoid him.
Just avoid him.
Literally, like totally scary looking guy.
Lord.
I pulled out a pack of needle, opened it, saw the needle, passed out.
Oh my goodness.
Are you serious? And he's
That's
tattooed
serious.
all over.
Yeah,
Isn't that
tattooed
funny?
all over.
Scared of blood.
Yeah.
Those are the ones who come in here and pass out and they have their blood drawn, right? And they're all, isn't that something?
Right.
Yeah, needles don't bother me. No.
Most women are okay with it, but it's just men for some reason. I don't understand.
How long do they stay in? Like what you put them in?
So the question is, how long do the acupuncture needles stay in when he's treating a patient?
30 minutes. 30 minutes for it to, the reason why we leave it in for 30 minutes is because that's how long it takes for the energy to circulate throughout your whole body. And then we remove it.
And how long do you have to continue with the acupuncture to really feel benefits, or how long, is it just an
For
ongoing
stress,
thing?
usually people walk out with zero stress that session.
Really?
Yeah.
What about for liver? Like things like your liver and things like that?
Well, we don't treat the organ. When we say liver, it's actually a name after the meridian system that it runs through.
Okay.
So when we treat liver, we actually treating the system, not the organ directly.
Got it.
Yeah. So it all depends on the severity and how long. Basically, what you have going on and how long. So, and that all depends. Acute, typically 5 to 10 sessions. Chronic, a lot more.
Yeah. So you have long-term patients. Yes,
I-
yes. Every week. Yep, I know. I have an appointment every week working on my head with him. So it's going to take a long term. It took me 53 years to get in this shot, in this shape. It's going to take me a while to get out of it. That's what I tell people. But okay, where can people reach you? What's your phone number at the office?
I have to think about this.
Oh, you don't know?
615
Okay.
975
Wait. 615
975
975
7320.
7320. And what are your hours?
Monday to Friday, 9 to 6. And
Okay.
then Saturday, 9 to 4.
You work on Saturdays?
I do.
He works on Saturdays, guys. That's a big deal. I don't work on
Yes.
Saturdays anymore. I used to. 3 years into it, I was working on Saturdays. Nope, no more. No more, right?
Yes.
Yeah, so,
How long
okay,
does it take to get an appointment?
yes,
Right now, I'm booked out 2 weeks.
Okay.
About a week and a half to 2 weeks.
okay. So you can get an appointment in 2 weeks, 2.5 weeks, somewhere around there. Do you take insurance or is this a direct pay practice?
It's a direct
Okay.
pay practice.
All right,
But I do provide super bill where you can submit it to insurance if they cover acupuncture.
that's right. And if you have a health savings account, you
FSA.
take a FSA, because I do
Yes,
here.
definitely.
You can buy your supplements with your FSA.
Right.
In this office, if you're in a provider's office, you can use your FSA or HSA, and that makes a big difference. So, and average appointment, new patient appointment, do you have? Are they like mine is 90 minutes for the new patient appointment, 30 minutes for follow-ups.
Yeah. So yeah, first session is 90 minutes long, and that's
Okay.
Half the time is going over your health history, just
Sure,
talking about everything and
that's right.
finding out the root cause.
That's right.
So that's
There's a
really
root cause for everything because we weren't born with stagnated livers or heartburn or migraine headaches or
That's right.
vertigo or anxiety or depression or bipolar. You weren't born with any of that. We turn those things on and people don't get it. Traditional allopathic medicine doesn't get that. We treat the symptoms,
Right.
not the root cause.
Exactly.
And I was taught to treat the symptom, right? It's a Prozac deficiency.
Yeah.
There you go.
Wow.
You got a Nexium deficiency. There's your Nexium, right? And boom, treat them and street them. That's how I used to say it. That's what I was taught. Just treat them and street them, and then they just never get better.
Are you in Nashville or Springs?
Franklin.
You are in Franklin.
He is located in Franklin on Carruthers and Physicians Way.
Correct.
Is that correct?
Yes. I'm located inside Encompass Health Hospital.
Encompass Health Hospital is a rehab hospital.
Rehab hospital.
Yes.
Inpatient rehab hospital.
Inpatient rehab. Yep, over here. So that's great that you're in there. Do you get a lot of referrals from them?
I get referrals sometimes, but I haven't really
But not from
approached them. I haven't really approached them about it, but they know I am there.
Okay.
So
Okay.
I know all the doctors there, and they're pretty amazing. They're very, very amazing.
Well, I think you're pretty amazing, and I
Thank you.
thank you for being here. I know you don't think you'd like to speak and all that, but you did a great job,
Thank you.
and
so
you love
much.
what you do. I can tell.
I do.
I do. So anybody can make an appointment. Go see him. I'm a big fan of him. I was a fan of his whenever I met him at the Holistic Chamber of Commerce, right?
Yep.
Yeah, that's where we first met, I think. Yeah. So go see him. I can't wait to check you out. Do you have a supplement store in there? Like, can people come in and
Yes.
do they need to be a patient of yours to buy?
Yeah.
Okay. Oh, yeah.
Well, first, I think for the law, they have to be a patient. It's
Okay.
It's not like a store. It's
Okay. Okay.
a clinic.
It's a little different than ours. Okay.
Yeah.
Okay. Well, then you guys need to sign up. Go see Dr. Joe. Do you have anything else you want to say on stress or anything? You can talk about anything. Sorry.
No, not at the moment.
Well, I love it. And you're spot on, man. You got to have community. You have to learn control. You have to eat well, sleep well, all those things. You have to breathe.
Breathe.
And it's Easter, and you're going to be with your family maybe this weekend. And so this is a perfect timing for this because, yeah. So I know. So I got to tell you all a funny story. This is not funny really, but it's sad because my mom has dementia, and you all can relate to this. Many of you who know me know that my mother and I have never gotten along. I'm an only child, and apparently from when I was a year old, I started pulling away from my mother. That's what she told me. So whatever. And it's been like this from day one. We've never got along. So this week I called her. I was out exercising, moving my body on my catcher, just walking. I called my mom. I said, Mom, for Mother's Day, if you find me somebody, because she's still got, she's not like in full-blown Alzheimer's, I will have your carpets cleaned for you. I'll pay to have your carpets cleaned. Well, then, and that was good. So there was no arguing there. And then she started talking about her wood floors, and she started talking about other things. And I said, yeah, actually that whole part of that house needs to be just demolished. Well, apparently that didn't go over well. And that offended her. And I'm trying to learn to say things nicer, and they keep reminding me here to be a little nicer. But so I just kind of smoothed it over. I thought I smoothed it over. All right. And said, all right, Mom, just call somebody and I'll take care of the bill and have that done. So then I go about my way, right? 3 hours later, this was Monday night. 3 hours later, I'm in my kitchen cooking or something. The phone rings. It says, Mom. My mom does not call me unless there's a problem. So I picked the phone up. I said, hey, Mom, what's up? She goes, Danielle. Exactly like this. Danielle. And I said, yes. And she said, you know something? Every time you come up here or every time you talk to me on the phone, you upset me tremendously. You upset me. And I'm torn up for days after I see you or I talk to you. And I said, what? She goes, I'll tell you what. I know you're coming to Kentucky this weekend with Jackson. She said, Jackson's welcome. You're not. And I went, oh, yeah, just like that, Teresa. I go, what? I said, okay. I'm not sure I understand, but okay. And she goes, so I'm just telling you, Jackson can come by, but you are not welcome here. And I said, okay, I guess I'm not cleaning your carpets either. Boom, and click the phone. I didn't know what to say. So I hung up and that was the end of that. And so that's family. That's family. I'm not the only one who has that kind of stuff going on. But yeah, it was like, what in the Sam Hill? And now we're all going home for Easter. And I guess I'm not going to Gilbertsville, Kentucky because I'm not welcome. But so we've all got stress, right? And so I'm going up there. I'm taking my gluten and dairy enzymes. I hope I don't get gluten or dairy, but you never know. And there you go. Stress, we all have it. Everybody has it. And everybody has family dynamics. And, you know, it's just how, but I used to would have worried about that, torn up, called her back on the phone, and it would have been one big blow up. And I thought, no, I'm just going to hope she forgets about it. It's just so, I know, right? So I'm just going to let it lay. I'm not going up there for Easter and just let it lay and maybe, you know, but yep. I guess that's the fire in me, right? I just tear everybody up around me, just tear them all up. So he doesn't even know what to think. He's like, what?
The yang energy. Right?
Man, she needs some acupuncture bad and some tinctures. She needs 4 pots boiling.
I'll bring my supplements.
Okay.
This was a therapy session in and of itself.
That's exactly right. Yeah.
Exactly. It's kind of like a sport network here.
There you go.
Yeah.
All right, guys, we appreciate you. Happy Easter. Today's Good Friday. Yes.
Yes.
Next Sunday, that's the 28th.
28th.
I think that's right. 7 o'clock, Dr. Justin Deering's going to be at my kitchen table. We're going to be talking the gut-brain axis, Sunday night service live. It's going to be fun.
It will be
I'm
great.
excited about it. It's going to be good. All right, guys, have a great weekend. Thank you so much for being here.
Thank
Give
you,
him a
Dr.
call.
Yes.
They're so sweet. I was so glad to sit between you two.
Oh.